We define chronic wounds as wounds that have been there for 4 weeks or longer. That doesn't mean you have to wait for 4 weeks before you see a wound specialist. Wounds that are getting worse despite treatment from your primary care physician should be referred to a wound center. I think you should be referred to a wound center early if you've had a prior wound and are familiar with what we do here. No, most wounds that we see here require a moist wound environment in order to heal. So the wounds that we see in the wound center require a moist wound environment in order to heal. Now that's not true for all wounds, which is why it's very important that any suspicious wounds or chronic wounds be evaluated by a wound care specialist. Again, that depends on the type of wound. Again, most of the wounds that we see here, you can let them get wet. You can let the soap and water run over them. You don't want to put direct pressure. You don't want to soak in a jacuzzi or a tub, and you don't want to put a direct spray on the wound because that can actually damage healing tissue, or it can even push bacteria into the wound bed. But again, there are some wounds that you don't want to get wet, and you really need to seek a professional advice before proceeding. Again, that goes back to the type of wound. Most wounds, if you forget it for a day, is not a problem. Letting it go longer than that, even a week or more especially, then you run the risk of having an infection. Wounds that require cleaning that you can get wet, we like to use a wound wash that provides the appropriate amount of pressure in order to remove any dead tissue, but not so strong that the bacteria is pushed into the wound tissue. I would avoid whirlpools. Usually the pressure in a whirlpool is far too great, and it can create an infected wound by pushing the bacteria into the wound bed. You can use lotion on the surrounding dry skin. I would not recommend putting lotion on the wound itself. We suggest a product that has urea in it, 10 to 20%. It's not easy to find in your local pharmacy. Many people have had to order that through Amazon, but we find that to be the most effective moisturizer for dry skin. I would avoid, again, like having the wound open to air, I would avoid sun or sun rays, anything that can possibly dry out the wound. Well, I think the most significant thing you have to keep an eye on is if it becomes red, especially if it becomes red, swollen, painful, and hot. That could indicate a skin infection, which would require an antibiotic to treat. Both betadine and hydrogen peroxide have been shown to damage healing wound tissue, and so you should avoid betadine and hydrogen peroxide in the use of good wound care. It is very important for diabetics to keep their blood sugar in good control. High blood sugar or out of control blood sugar does predispose you to having skin problems, especially if it affects your nerves and you lose sensation in your feet. Then you can end up with very serious ulcers and ultimately with amputations. Well, we like to know if there's been any changes to your medications, if you've seen your doctor since your last visit with us, if there have been new health problems, if you've gone to the emergency department, and of course things such as if you've had a fever, chills, any type of flu, cold, anything that would indicate an infectious process. We do want to know. We want to know if you monitor your own blood pressure, if your blood pressure has been out of control, and especially if you're finger sticks have been out of control. Most of our patients are referred by primary care physicians, urgent care centers, or from the hospital. The most common thing, or two, I should say the most common two wounds that we see are pressure ulcers and venous ulcers. And we take the approach that we want to heal the wound, but wounds are not necessarily the problem, that wounds are a sign of something else going on. And so we explore what's going on with the person. Is it a problem with your veins? Is it a problem with your arteries? Is it, again, out of control diabetes, which has killed the nerves in your feet, so you have no sensation in your feet? And so we can make recommendations not only in healing the wound, but after the wound is healing on how to prevent it. Pressure ulcers most commonly occur in somebody who has been on bed rest or prolonged immobilization. We are programmed to sense, if we're sitting in a chair for too long, to sense when there's too much pressure, and we just, at a subconscious level, we move, we get off of it. Well, some people that are very weak, or patient who let's say has paraplegia and doesn't have the ability to move, if those people stay in one spot for too long, especially over a bony prominence, like the low part of your back here, or the back of your hips, ankles, those are places where we do see pressure ulcers. And so what ends up happening is that deep down in the tissue, the tissue is being starved of blood because of the pressure. The pressure is actually pinching off the blood supply to a specific area. And then with the blood supply being pinched off, you start to get dead tissue, which then develops into an ulcer. With a venous ulcer or venous stasis ulcer, these are people who have problems with their veins. Now, as we get over 35 years old, we all start to have problems with our veins, and we see that in the form of varicose veins and maybe swelling in our legs. The veins are the pipes that take the blood against gravity from your feet back to your heart. And they're designed to have valves so that as our legs pump when we walk, that pumps the blood up against gravity, and then the valves prevent the blood from going back down. Unfortunately, as we get older, those valves fail, and the blood will start to pool in our legs. That's called venous hypertension or venous insufficiency. And the way that you would see it is your legs would be swollen. Of course, you would probably have some type of varicose veins. You might start to see a discoloration of your skin, usually brown, and that's because the iron in the red blood cells is breaking down and then leaking out of the blood vessels and getting into the skin. And that's very toxic to the skin, and that puts you at risk for developing ulcers because your skin does not like the iron. The swelling also puts stretch on the skin, which also can predispose you to ulcers. And we have to treat the underlying problem in addition to treating the wound itself. We have to identify the venous stasis. There are some outpatient surgical techniques now which can be very helpful, but we have to treat that underlying problem and then provide chronic long-term prevention. Hyperbaric oxygen therapy, these chambers that are behind me, that is where 100% oxygen is being pumped in to these chambers while we gradually increase the pressure. So it's like diving. And in fact, that's what we call the treatment. We call the treatment a dive. And what that does is, with the pressure and the 100% oxygen, that dissolves more oxygen into your blood. Typically, oxygen is transported in your blood by hemoglobin, a specific molecule that's on the red blood cells. But when you have 100% oxygen, under pressure, you can actually dissolve the oxygen right into the plasma. So it's taking to where the wound is an oxygen-enriched blood. There are about 12 diagnoses that the FDA approves for hyperbaric. We typically only see the diabetic foot ulcers with bone infections or non-healing wounds, or people who've had surgery to heal their wounds and that surgery is starting to fail.